we're going to be talking about vaginal discharge with offensive odor or with bad foul odor. So, we are saying that vaginal discharge with an offensive bad odor usually means there is an imbalance or infection in the vagina. While some vaginal discharge is normal and healthy, a strong, unpleasant smell is not normal and should be checked. What it commonly means, here are the most frequent causes. One would be bacterial vaginosis, is the most common type of bacteria that will cause offensive odor. Bacterial vaginosis, the most common bacteria that affect the vagina, have a strong offensive odor. Sometimes it smells like fishy smell, especially after sex. Discharge would be tiny, gray, or whitish. And what are the causes of this? That would be overgrowth of harmful bacteria, not usually an STI. STI, sexually transmitted infection, but linked to sexual activities. Trichomoniasis. Trichomoniasis is a sexually transmitted infection. It also has a foul, offensive odor, smell like foul or fishy smell. Discharge like yellow, green, fruity, frosty. Other signs include itching, pain during urination or sex. This requires immediate medical treatment. Okay, so yeast infection. Yeast infection is less odor but possible. Okay, odor is mild, bread-like, not usually offensive. Okay, odor will be mild, bread-like, not usually offensive. So yeast infection discharge is thick, whitish like cottage cheese. Okay, other side would be severe itching and redness. Another possible cause of vaginal discharge, or what it means, will be poor hygiene or retained object, forgetting typo or menstrual cups. This can cause vaginal discharge with offensive odor. Can cause a very strong rotty smell. Okay? Pelvic or septic infection may also cause foul odor with pain, fever, or bleeding. This needs urgent medical attention. When to see a doctor? Seek medical care if you notice strong or persistent bad smell. Seek medical advice ASAP. You notice green, yellowish, or gray discharge. So infection. Seek medical advice. You notice itching, burning, or pain in your vagina. Seek medical advice. Bleeding between periods. You are not seeing your period, but you are bleeding. You will need to see a medical provider. Fever or pelvic pain. You need to see your medical provider ASAP. What you should not do, okay? If you are having this strong offensive vaginal odor, what you should not do. 1. Do not douche because it worsens infection. Do not use scent soap or vaginal spray because this will worsen infection also. Do not self-medicate repeatedly without diagnosis. Some people, when they have this vaginal discharge, they go and buy medication, try to get some antibiotics for themselves. You cannot do that. They have to call short that discharge to be able to know what that bacteria or fungi or whatever is causing that discharge is resistant to. The doctor have to know before they order prescription. So don't just go and get yourself any kind of medication. Okay? You can't do that. Okay? So what help prevent it? What help prevent vaginal discharge with offensive odor? We said maintain gentle hygiene. Okay? Wash your vagina with warm water, mild soap, externally only. Okay? Practice safe sex. Okay? Change your underwear daily. Cotton underwear preferred. Okay? I will also strongly advise that you seek treatment early. Okay? So key takeaway from this will be offensive smelling vaginal discharge is usually a sign of infection, most commonly bacteria, vaginosis, or an STI, sexually transmitted infection. It is treatable, but proper diagnosis is important. Okay? So let us go back again and recap for the sake of those just joining us. We are talking about what is vaginal discharge with offensive or unpleasant smell. So we are saying that vaginal discharge with an offensive bad odor usually means there's an imbalance or infection in the vagina. Whilst a vaginal discharge is normal and healthy, a strong, unpleasant smell is not normal and should be checked immediately. And what this commonly means is here are the most frequent causes of vaginal discharge. So one, bacteria called bacterial vaginosis is the most common bacteria that cause vaginal discharge with strong offensive odor. So vaginosis has a strong fishy smell. It has strong fishy smell, especially after sex. And discharge from vaginosis is thin, gray or whitish. Causes will be overgrowth of harmful bacteria. It is not usually an STI, but linked to sexual activity. Okay? Trichomoniasis. Trichomoniasis is a sexually transmitted infection, STI. It has this foul or fishy smell. So when it has this yellowish, greenish, fruity discharge. When you see yellow and greenish discharge, that's an infection. Okay? So other sign of trichomoniasis would be itching, very painful during urination or during sex. This requires medical treatment immediately. We also talk about yeast infection. Yeast infection has less odor but possible. I would say that yeast odor associated with yeast infection would be mild bread-like smell, not usually offensive. Okay, discharge from yeast infection is thick whitish, like cottage cheese. Other signs of yeast infection will be severe itching, redness. One also said that poor hygiene or retained object can cause a very unpleasant smell, can cause a very unpleasant vaginal discharge with offensive odor. Forgotten tadpole or menstrual cup in your vagina. This can cause a very strong rotty smell. Pelvic or cervical infection may cause foul odor with pain, fever, or bleeding. This needs urgent medical attention. When to see a doctor, I will strongly advise you that seek medical care if you notice strong or persistent bad smell. You notice green, yellow, or gray discharge. Seek medical advice immediately. You notice itching, burning, or pain. You need to seek medical attention immediately. Bleeding between periods. You are not on your regular period, you're not on your regular cycle, but you are bleeding. You need to seek medical attention. Fever or pelvic pain. You also need to seek medical attention ASAP. What you should not do. We said if you're noticing this strong, unpleasant, foul smell, do not douche because it worsens infection. Okay? Do not use scent soap or vaginal spray. This will only worsen the infection. I will also say that do not self-medicate repeatedly without diagnosis because they have to culture that discharge to know what that bacteria is resistant to. So you can't take antibiotics without prescription. Don't take any medication if you're having this smell, trying to self-treat yourself. Don't do that. Go to your medical provider and seek medical help. Okay? So what help prevent vaginal discharge with strong offensive odor. Remember, we said that it is not all vaginal discharge that is infection. Some are very healthy, but the one that have persistent, strong, unpleasant smell, you need medical attention. But how can we help prevent this? We are saying that maintain gentle hygiene. Use warm, mild soap externally. Practice safe sex and change your underwear daily. Cotton underwear is preferred. Okay? We also said that you should seek medical treatment early. So the key takeaway here is vaginal discharge with offensive smelly vaginal discharge is usually a sign of infection. Key takeaway here. Most commonly bacteria is a vaginosis or an STI. It is treatable, but proper diagnosis is important. Okay, so we just talk about vaginal discharge. So let's talk about penis discharge. And we are saying that what is penis discharge with offensive odor? We are saying that penis discharge with an offensive foul odor usually means there is an infection or inflammation in the urethra or reproductive tract. It is not normal and should be medically evaluated. Okay, so what are the common causes of penis discharge with foul odor? 1. Sexually transmitted infection, STI. These are the most common causes. Okay, and one of the most common causes of penis discharge with strong offensive odor would be gonorrhea. Gonorrhea discharge is thick yellow-green discharge with strong offensive smell, burning during urination. Chlamydia. Another causes of penis discharge with strong offensive odor is chlamydia. Chlamydia discharge will be clear or cloudy discharge. Mild odor. May have little pain. Trichomoniasis. It's another cause of penis discharge with strong offensive odor. And we are saying that trichomoniasis discharge will be thin, foul-smelling discharge, sometimes fishy odor. Bacterial infection, non-STI. What would this be? This would be a poor genital hygiene can allow bacteria to grow under the foreskin, mostly uncircumcised male. Okay, can produce bad odor, redness, and discharge. Ballitis is inflammation of the penis head. more common in uncircumcised men. It's caused by bacteria, fungi, yeast, or irritation. Symptoms are bad smell, discharge with offensive odor, itching, redness, and swelling. Remember, we're talking about common causes of penis discharge with strong, unpleasant, embarrassing, offensive odor. Okay. Urinary tract infection (UTI) can also cause discharge, but is less common in men, but possible. Discharge may be minimal with men. Strong odor, pain, frequent urination. It can be attributed to urinary tract infection. Yeast fungal infection. Yeast fungal infection has this thick white discharge, unpleasant odor, itching, and redness. More common in people with diabetes or weakened immunity. Okay. Warning sign that need urgent care. When you have severe pain or burning when urinating, you need medical attention immediately. You have fever, you need medical attention immediately. Swollen testicle, you need medical attention immediately. Blood in urine or discharge, you need medical attention immediately. Symptoms lasting more than a few days, you need to see your medical provider ASAP. What you should do if you're having this strong offensive discharge: see a doctor or visit an STD clinic immediately. STD is sexually transmitted disease. Visit sexually transmitted disease clinic immediately if you're having all these symptoms that I have been measuring. Get urine tests and swab to identify the cause. Okay? Avoid sexual activity or teen treated. This is Gateway 101. Remember, we place emphasis on prevention because we strongly believe that prevention is better than cure. So if you are having penis discharge with strong, offensive, embarrassing, unpleasant odor, avoid sexual activity until you are treated. Do not self-medicate with antibiotics. Okay? Do not self-medicate with antibiotics. Also, be fair enough to inform your sexual partner if an STI is diagnosed. Prevention tips. Because Gateway 101 we believe on prevention because we strongly believe that prevention is better than cure. Prevention tip will be practice safe sex. Use condom. Maintain good genital hygiene. Get regular STI screening if sexually active. Okay? Manage condition like diabetes properly. We have a chronic condition. Make sure it is properly managed. Okay? So let us go through this again one more time. Let's recap for the sake of those who are just joining us. Let us recap. We are saying that penis discharge with an offensive, foul, embarrassing, unpleasant smell usually mean that there's an infection or inflammation in the urinary or reproductive tract. It is not normal and should be medically evaluated ASAP. Common causes will be sexually transmitted infection, STI. And the most commonly sexually transmitted infection will be gonorrhea. And we do state that thick, yellow, greenish discharge with strong smell, bony sensation during urination. Those are symptoms of gonorrhea. Gonorrhea discharge are usually thick, yellow, greenish discharge with strong, embarrassing, offensive smell, burning during urination or during sexual activity. Chlamydia. Chlamydia discharge will be clear or cloudy discharge. Mild odor, may have little pain. Trichomolysis. Trichomolysis discharge will be thin, foul smelling discharge, sometimes fishy odor. Mycoplasma. Mycoplasma will be persistent discharge and irritation. We also talks about bacterial infection, non-STI. We say that poor genital hygiene can allow bacteria to grow under the foreskin, mostly for uncircumcised male. Can produce bad odor, redness, and discharge. Volatilysis, which is the inflammation of the penis head, is more common in uncircumcised male. The causes might be caused by bacteria, fungi like yeast, or irritation. And the symptom will be bad smell or present smell, discharged, itching, redness, swelling. A common term for discharge will be leaking. When you hear people saying you're leaking, meaning you have this discharge. Urinary tract infection, UTI, may also cause discharge. Less common in men, but possible. Okay, discharge may be minimal. Strong odor, frequent urination, yeast fungal infection, thick white discharge, unpleasant odor, itching, redness, more common in people with diabetes or weakened immunity. Okay. Yeast fungal infection is more common in people with diabetes or weakened immunity. One side that you need urgent care will be severe pain or burning when urinating, fever, swollen testicle, blood in urine or discharge, symptom lasting more than a few days, what you should do? You should seek a medical or visit an STD clinic immediately if you notice this symptom that I have been talking about. You notice the discharge with unpleasant, offensive, strong odor. You need to see a doctor or visit an STD clinic immediately. Get urine tests and swab to identify the causes. Avoid sexual activity until treated. If you are leaking, if you are discharging, please, you got to have treatment before you engage in sexual activity. Okay? And do not self-medicate yourself with antibiotics. Don't do that, because you may not be able to know which medication is the bacteria or the organism resistance to. So you need a proper diagnosis. And you should be kind enough to inform your sexual partner if an STI is diagnosed. Like I said, we place more emphasis on prevention because in Gateway 101 we believe that prevention is better than cure. So prevention tip would be practice safe sex. Use condom. Maintain good genital hygiene. Get regular STI screening if sexually active. Okay? Manage conditions like diabetes properly. Okay? So let us talk about some possible home remedy for vaginal discharge. And we said that vaginal discharge with a foul odor is often a sign of an imbalance or infection. While home remedy may help mild, not serious causes, they do not replace medical treatment. Okay? Especially if symptoms persist. Okay? We said safe, simple home remedy you can only if symptoms are mild and there is no severe itching, pain, or bleeding. So, simple home remedy would be maintain proper hygiene. Okay? Wash the vaginal area once daily with lukewarm water. Use mild scent soap only on the outer area. Avoid douching. It worsens odor and infection. Probiotics, natural yogurt. Eat plain or sweetened yogurt daily. Help restore healthy vaginal bacteria. You can also take probiotic supplement, but with your medical provider guidance. Okay, apple cider vinegar, bath. Add half cup of apple cider vinegar to a warm bath water. Soak for 10 to 20 minutes. Help rebalance the vaginal pH. I take that again. Add half a cup of apple cider vinegar to a warm bath water. Let it soak for 15 to 20 minutes. This helps rebalance the vaginal pH. Please note that do not apply apple cider vinegar directly inside your vagina. Okay? Do not apply apple cider vinegar directly inside your vagina. Garlic, internal support. Eat 1 to 2 cloves of raw garlic daily with food. Natural antibiotics and antifungal properties. Do not insert garlic into your vagina. Okay? Do not insert garlic inside your vagina. Hydration. Drink plenty of water. This will help flush toxics and reduce odor. Wear breathable clothing, shoes, cotton underwear. Avoid tightened pants and synthetic fabrics. Change your underwear daily. Okay? Avoid scent product. Most scent pads, sprays, soap, or wipes they disrupt natural vaginal balance. Okay. When to see a doctor immediately. Seek a medical care immediately if you notice fishy, strong, or rotty smell. Gray, green, or yellowish discharge. Strong infection. Itching, burning, pain, or swelling. You need to seek medical attention immediately. Bleeding. You need to see medical attention immediately. Symptoms lasting more than 2 to 3 days. You need to see medical attention immediately. Then, if you are pregnant, you need to see medical attention ASAP. Okay, this may indicate bacterial vaginosis, yeast infection, or an STI, which require prescription treatment. Okay, so key reminder here will be home remedy helps support vaginal health, but persistent odor always needs medical evaluation to prevent complication. Okay, so let's recap again. We said that vaginal discharge with a foul odor is often a sign of an imbalance or infection. While home remedy may help mild, not serious causes, they do not replace medical treatment, especially if symptoms persist. Okay? I would say that simple home remedies such as maintaining proper hygiene will help prevent vaginal discharge with strong offensive odor. So we said wash your vaginal area once daily with lukewarm water. Use mild unscented soap only on the outer area of your vagina. I would say you should avoid douching because it will worsen odor and infection. You can also take probiotics recommended by your medical provider. Natural yogurt will also be of great help. Eat plain or sweetened yogurt daily. This will help restore healthy vaginal bacteria. You can also take probiotic supplement with your medical doctor guidance. You can also use apple cider vinegar bath by adding 1 cup of apple cider vinegar to warm bath water. Soak for 15 to 20 minutes. Help rebalance vaginal pH. Do not apply apple cider vinegar directly inside your vagina. Don't do that. Okay. You can also eat garlic. Eat 1 to 2 cloves of raw garlic daily with food. Natural antibiotics and antifungal property. Please do not insert garlic into your vagina. Hydrate yourself really good. Drink plenty of water. Help flush toxics and reduce odor. Wear breathable clothing such as shoes, cotton underwear. Avoid tight pants and synthetic fabric. Change your underwear daily. Okay, avoid scent product. No scent pad, spray, soap, or wipes, because this disrupt natural vaginal balance. You should seek medical help immediately if you notice fishy, strong, embarrassing, unpleasant, rotty smell. Seek medical advice immediately. Gray, green, or yellowish discharge. You need to see a medical doctor immediately. Itching, burning, pain, or swelling, bleeding. You need to see a medical doctor immediately. Symptoms lasting more than 2 to 3 days. You need to see a medical doctor immediately. You are pregnant. This may indicate bacterial vaginosis, yeast infection, or an STI, which require prescription treatment. The key reminder would be home remedy helps support vaginal health, but persistent odor always need medical evaluation to prevent complication. Okay, so let's talk about simple home remedy for penis discharge. And we are saying that a foul-smelling discharge from the penis is not normal and is often a sign of an infection, such as a sexually transmitted infection, urinary tract infection, or balleritis. Home remedy can help with comfort and hygiene, but they do not cure the cause. Seeing a healthcare provider is very important. Okay? Okay. Here are safe supportive home steps you can do while arranging medical care. Important first, if the discharge is yellow, gray, thick, painful, bloody, or fast smelling, or if there is a burning during urination, itching, or swelling, do not rely on home remedy alone. Antibiotics or antifungal medication may be required. See your medical provider immediately. Safe home care, supportive only. Gentle daily cleaning. Wash your penis once daily with warm water. If uncircumcised, gently pull back the foreskin and clean underwear. Do not use soap inside the penis. Antiseptic, vinegar, lime, salt, or herbal paste. Keep the area dry. Musk strap promote bacterial and fungal growth. Keep dry thoroughly after bathing. Wear loose, breathable cotton underwear. Increase your water intake. Drink plenty of water to help flush the urinary tract. Very important. Avoid sexual activity. Do not have sex until symptoms are checked and treated thoroughly. You could pass an infection to a partner, so avoid sexual activity if you are having any of these symptoms. Probiotics optional supplement. Plain yogurt or probiotic food may help overall balance. Okay, I will say what not to do. Do not insert substances into the penis. It's very itchy and you have this strong offensive odor. You'll be leaking, you'll be discharge. Please do not insert substances into the penis. Do not self-medicate with leftover antibiotics. Don't do that. Do not ignore the symptoms. Okay? Do not assume if it will go away on its own. Don't do that. Seek medical advice. Okay, you need to see a medical doctor. Very important. ASAP when a healthcare provider as soon as possible if discharge has a bad odor. Okay. There is burning. There is burning when urinating. You need to see a medical provider ASAP. Discharge is yellowish, grayish. That's an infection right there. You need to see your medical provider ASAP. Okay. You recently had unprotected sex. You need to see a medical provider immediately. Symptom lasting more than 1 to 2 days. You need to see a medical provider ASAP. Most causes are easily treatable if they are identified early. Okay? So remember that in Gateway 101 we place emphasis on prevention because we strongly believe that prevention is better than cure. And here we're talking about a simple home remedy to treat penis discharge. I was saying that a fast-smelling discharge from the penis is not normal and is often a sign of an infection, such as sexually transmitted infection, urinary tract infection, balanitis. Some remedy can help with comfort and hygiene, but they do not cure the cause. Seeing a medical healthcare provider is key. Okay? I will say that important if discharge is yellow, green, thick, painful, bloody, or foul smell, or if there is burning during urination, itching, or swelling, do not rely on home remedy alone. Antibiotics or antifungal medication may be required. Okay? Home safe care, supportive only, gentle daily cleaning. Wash the penis once daily with warm water. If uncircumcised, gently pull back the foreskin and clean underneath. Do not use soap inside the penis. Antiseptic, vinegar, lemon, salt, or herbal paste. Keep the area dry because moisture area promote bacteria and fungus. Dry thoroughly after bath. Wear loose, breathable cotton underwear. Okay. Wear loose, breathable cotton underwear. Increases your water intake. Drink plenty of water to help flush the urinary tract. Okay. Avoid sexual activity. Do not have sex until symptoms are checked and treated. Okay. You could pass an infection to your partner. So you got to wait until you are checked out and properly treated. Probiotic optional support. plain yogurt or probiotic food may help overall balance. This is supportive, not a cure. Warning: do not insert substances into your penis. Don't do that. And do not seek medical with leftover. Do not seek self-medication with leftover antibiotics. And do not ignore the symptoms. Don't do that. Do not assume it will go away on its own. Do not assume that. Okay, when to see medical attention immediately. Very important. See healthcare provider as soon as possible if discharge has a bad odor. Seek medical attention if there is burning when urinating. Seek medical attention if discharge is yellow or greenish. Seek medical attention. You recently had unprotected sex. To seek medical attention immediately. Symptoms last more than 1 to 2 days. Seek medical attention. Okay? So this is Gateway 101, where we place more emphasis on creating awareness to the community that we serve, creating prevention tips for the community that we serve. We strongly believe that prevention is better than cure. So please, if you are having a strong offensive odor, or you're having a discharge, or you are leaking, please seek a medical help immediately. We also have a simple home remedy that will help alleviate this symptom. So you can check that out on Gateway 101 channel. Okay? But we'll come here will again. This is Gateway 101. Thank you for watching.